Andre Picard has been a Globe and Mail columnist and award-winning health reporter for over 30 years. He's also a best-selling author. He joins me now to talk about his latest book, Matters of Life and Death, Public Health Issues in Canada. Good morning to you, Andre. Thank you so much for being here.
Good morning.
Congratulations on the book.
Thank you.
This is such a useful tool, I think, for so many Canadians because it really outlines where we are in Canada and how we're going to move Medicare right into the 21st century, as you say. What do you think are some of the most pressing issues concerning Canadians in healthcare?
I think there are a lot of little things, but I think there are two big issues. Politically, I think the big issue is Indigenous health. We really have to tackle that. That's sort of a shame, a blight on our society that we haven't dealt with this. And the other one, the more practical one for the general population, is wait times.
Wait times,
so
absolutely.
Canada is known around the world, oh, that's the country where you wait. We spend as much more than most countries in the world on healthcare, and you don't see waits like we have. We have waits in the ER, waits to see a doctor, waits to see a specialist, wait to get in a nursing home. It's something we really have to tackle in a serious way.
Absolutely. Do you have any ideas, some solutions, some ideas on what we can do to bring those wait times down?
Well, how many hours do we have?
Right, exactly. I've got 5 minutes.
Okay, but you know, there's some, I think it's important to say that we have really good medical care in Canada.
I agree.
So what we have to do is get the administration and the engineering right.
Yes.
So a good example in Canada is we don't really have a front door in our system, right? The front door is a default, it's the emergency room. So I always use the analogy, I say to people, would you enter your home through the emergency exit or climbing through the basement window?
Right.
That's the equivalent of what we do. So since the system is kind of nonsensical,
right,
and we lose people, you get great care wherever you are, but when you have transitions, that's where all the bad things happen in Canada.
Absolutely.
And it's because the system isn't really a system, it's fundamentally the problem.
It's fundamentally the problem. I'm a big advocate for patients advocating for themselves and empowering themselves about their own medical issues. How does that work for patients? How do they really need to get started? Is it all about having all their information in one place?
Well, you know, I think ultimately it's two things. You have to do some self-care, so you have to take some responsibility for your health. And the other aspect of it is systemically, we have to have a medical home. So the really good health systems in the world, somebody is associated with either a family doc or a clinic, a nurse practitioner, but one person's responsible for you and they guide you. So what we really need these days is somebody to help. Medicine's complicated, so you need some guidance. So that's what we need. And more, we had a story on this in my paper last week, that people are hiring navigators to help them through. But in some parts of our system, like cancer care, we have navigators in the public system, and they pay for themselves because you avoid duplication of tests, you avoid missed tests, you avoid overtreatment. The biggest single thing people need when they're sick is usually information. So you go to the doctor, you hear the C word, you have cancer, you hear nothing.
Right.
And then you go home and you say, well, what did he say for me for 10 minutes? I don't know. That's what the navigator is for, is to give you some comfort and some information.
Absolutely, absolutely. What about universal drug coverage? Because I've often thought, if we've got a system where we're already paying for our health care, someone's looking after that for us, but then they don't pay for the drugs that we've been prescribed or they're supposed to help us feel better and do better, how does that make any sense?
Well, it's really the unfinished business of Medicare, right? So the philosophy is Medicare is everyone should get medically necessary care without bankrupting themselves, you know, without it being a cost. We do that for doctors, we do it for hospitals. It doesn't make sense to leave drugs out of the equation. So we have these patchwork systems in Alberta. There's about 7 different drug plans, but we just need one coherent one that covers everyone. And it doesn't mean cover all drugs for all people forever.
That wouldn't
it means
be
doing the essentials.
Right, wonderful. What about this idea of prevention too, right? Because we have an acute care system. We take problems once they've already happened. What about preventing them in the first place?
Well, we have a sickness care system, and what we need is a healthcare system. So a lot of stuff, we spend enormous amounts of money treating people for preventable illnesses, heart disease, a lot of dementia we know is preventable, etc. So again, it's a mixture of self-care. People have to take some responsibility, but we also have to give them education, and we have to give them the means to be healthy. And we don't often do that. It's hard to, you know, go to your doctor and say, listen, I don't want to have heart disease in 20 years. Hey, that's not my problem next. I treat sick people.
That's right, that's right. Okay, lots of great ideas here. Thank you so much. Congratulations on the book. You have a signing tonight at Shelf Life Books, if I recall. Yes, book launch at the Calgary Public Library, pardon me. Central Library, 616 McLeod Trail Southeast, tonight, 6:30 until 8:30, so you'll be there.
Yes, I'm looking forward to it. Thanks.
Wonderful. Andre, thank you so much, and again, congratulations on the book.
Thank you.